Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Investigations for endometrial carcinoma. The first investigation done for endometrial carcinoma is transvaginal ultrasonography. On transvaginal ultrasonography, if the endometrial thickness is measured, if it is more than or equal to 5 millimeters according to FIGO classification, or it can be more than or equal to 4 millimeters as per ACOG classification. In such cases, you will have to do endometrial sampling. Endometrial sampling can be done in two techniques. One, you can do endometrial biopsy can be done. Second, endometrial sampling by endometrial aspiration cytology can be done. The main difference lies in the instrument used. Endometrial biopsy is done by using an endometrial biopsy curette, whereas endometrial aspiration cytology is done using Carmen's cannula in India and a pipple in developed countries. Endometrial sampling is the investigation of choice in uniformly thickened endometrium. In a localized thick endometrium, the investigation of choice after transvaginal ultrasonography is hysteroscopic biopsy. Indications for endometrial biopsy. In case of localized thickness, we will have to visualize the thickness. So after doing transvaginal ultrasonography, by hysteroscopy we can visualize the thickened portion and we can take the biopsy. So for localized defect, hysteroscopy with biopsy is the main investigation of choice, whereas for generalized thickness, where the thickness is completely uniform overall the uterus, so we can take the sample for any from any part of the uterus. So endometrial aspiration with pipple or Carmen's cannula is the investigation of choice. Then indications of endometrial biopsy. Endometrial biopsy indications are: it is done endometrial biopsy is mainly done in the postmenopausal bleeding with endometrial thickness more than 4 millimeters, and it is also done in an AUB patient, that is abnormal uterine bleeding patient with age more than or equal to 445 years, and it is also indicated in reproductive age with endometrial thickness more than 12 millimeters. Go
thank you and thank you for watching.